Hello everyone, welcome to Yazhini's Park. Let's heal and learn together. I'm Yazhini, your nursing tutor. Today we are going to dive into the fundamentals of applied anatomy with the topic of anatomical position, and this is for BSc nursing first year students in the first semester, and it is of unit 1. If you are nursing students or just curious about the human anatomy, stick around. This will help you to know more and also understands how we describe the body parts in the standard way. Let's get started. By the end of this video, you will be able to define the key terms related to the anatomical positions and apply this knowledge to the real clinical situations and therapeutic applications. Also think about how this is helpful in the things like describing the patient symptoms or planning treatments. It is the foundations for the nursing students. It is the main important aspects for all throughout the year. Now let's define about the anatomical position. This is the standard reference pose for describing the human body. That is of standing upright with the feet together and flat on the ground, arms and at your sides and palm facing forward and head facing straight ahead. And look at the image here. We can notify everything is up aligned symmetrically, and this position ensures that when the doctors or the nurses talk about the body parts, we are all on the same page, no matter the patient actual postures or in a clinical practice we use this to accurate locate to the injuries or the organs. Moving on to the directional terms, that is of superior means towards the head or upper part of the body. For example, the heart is a superior to the stomach. Inferior is the opposite towards the feet or the lower part, like the knees or the inferior to hips. See the arrows in this diagram. In nursing, this helps when assessing things like superior vena cava issues or inferior limb swellings. And remember, these terms are always related to the anatomical positions. Next comes of anterior. Anterior refers to the front of the body. Think of your nose being anterior to your ears. Posterior is the back. Your spine is posterior to the heart. Check out this front and back view in the image. Clinically, this is cruel describing the wounds. The posterior wounds might be on the back, while anterior could be on the chest. Applying this in the patient care, this may prevent some miscommunication between the healthcare professionals. This is the example what I said, that are the sternum is the anterior to the heart is the posterior to the sternum. This is the example. Just look into that. Commonly, we all know the lateral view is of side view. The picture itself, you can easily understand the lateral view of side is of lateral view. Proximal is of closer to the point of attachment or the trunk. For forearms, the shoulder is proximal to the elbow, and distal means of further away. Your fingers are distal to your wrist, and look at this labels pointing on the limb diagram. Therapeutically, this matters in the orthopedics. Distal fractures might be in the lower leg, affecting the mobility and differ from the proximal one. Already said in the previous slides, which is of a superior means towards the head, upper or above, inferior means towards the feet. Can observe in the image itself. It's easy to understand. And this is the example picture. By observing itself, you can easily understand that the heart is superior to the stomach and stomach is inferior to the heart. It's for given for the example purpose. Just look into it and understand. Any doubts you can ask in the comment section. I am ready to reply in it. Next comes of medial. Medial means towards the midline of the body. Imagine a line splitting you into the half. Your heart is medial to your arms and lateral is up away from the midline. Your ears are lateral to your nose. And the diagram here highlights that with the lines. In nursing, this is a key for procedures like IM injections and medial arms veins versus lateral ones. And this is helpful in analyzing the symmetrical in clinical examinations too. Superficial means towards the surface of the body, and like a skin is superficial to the muscles, and deep is towards the inferior. Bones are deeper to the muscles. This cross-section image shows the layers clearly in clinical situations, and this is a vital for wound care, and also superficial cuts versus deep tissue injuries when we are administering the deep intramuscular injections. Here is a mind map summarizing everything. The center node is of anatomical position and branching into the directional terms like superior or inferior, anterior, posterior planes. All this, just look into that, and any doubts you can ask in the comments. And this is a reference book. That's for today's sections on anatomical positions. Thank you for watching Yazhini Spark. Let's heal and learn together. Like, subscribe, and comment any question. See you next time. Bye bye.